Over on the other side of the park, an operation is beginning. One of the cats looked after by head of section Jim Vassey is in need of help, and it's one of the oldest and most loved at the park.
Well, the plan today, unfortunately, is we need to knock out Saba, our female serval. She's got an ingrown claw, and it needs to be tended to now rather than later, before it gets too bad. Our biggest concern is that her age. She's 19 this year, so she's getting on. So it has to be a delicate, quick operation. So we're going to knock her down, cut the nails, then bring her around straight away.
Cats use their claws to climb, scratch, and kill. And few cats are as quick and agile as the serval. Unlike her young and fit daughter Melindy, Saba is now very old and uses her claws less and less. Sadly, this is an all too familiar story for Jim and Saba. A year ago, they had to do exactly the same thing. Thankfully, they managed to cut the claw before it got infected. But today will be anything but routine.
Obviously, we did it 12 months ago. She was a little bit younger. Now, age is not on her side, unfortunately. And so we're always worried about doing this kind of thing. We need to do it because obviously, if she gets an infection in it, and as she's getting older, she won't be able to fight the infection as she did when she was younger. So it's a constant battle, and obviously you have some concern as well.
At 19 years old, Saba has been at the park longer than most animals and keepers.
She was actually hand-raised. So yeah, so she's got she'll always be a fond, happy cat, to us and to everyone else that knew her or knows her. So yeah, it is a worry.
But to ensure her good health, the operation must go ahead despite the risks. Jane the vet will be carrying out the procedure and first needs to dart Saba to make her fall asleep.
We're just going to get Melindy out of the shut off. Saba's just there, look, so if you want to go for it, Jane. Did it go off?
It went off, but I'm not convinced it all went in.
Using a blowpipe is the quietest and least stressful way to give the drug, but it's now vital that Jim monitors when she got it.
Jane darted Saba at 46 minutes to the hour, but it hit her, it bounced out. It's gone off, but we're not sure whether the drug's gone in her. So Jane's going to make another dart up, just in case. But we'll give her 5-10 minutes, and then if she starts to get quiet and go to sleep, then obviously it went off, but as a backup, we're just getting another dart ready.
Blow darting is an incredibly skilled job, and Jane and the keepers have had extensive training.
It depends on how they're sitting. You don't know where the bone of the leg is, so sometimes if it hits a hard skin area, i.e. with the bone, it sometimes hit that and just drops out.
Knocking out any animal has its risks, but with a cat as old as Saba, those risks quickly increase. A few minutes later, it becomes clear that they're going to need that other dart.
Saba's just got up and walked off, so I'm assuming that it hasn't gone off inside her. No, there's a little bit more stress added to it now, but Saba's a hold hand at these things, unfortunately, because now we have to go in and dart her at close range.
Not knowing how much or how little of this dangerous drug Saba has had is potentially very serious. Jim and Jane need this attempt to go perfectly.
Okay, and it comes outwards, that's it.
The dart went in, but there's another problem.
The dart went in, and some of the drug went in, but because Saba pulled it out so quickly, a little bit of drug, we saw spread out the needle. That didn't go in her, but hopefully she's got enough of the drug to knock her down, safe enough for us to get in and do the job.
With such a frail animal, this work is an exact science.
Age is against her, so we have to make sure the drug is the right amount for her weight, and then once we've done the job, we can reverse it. So we need to know how much drug she's had to be able to give her the right amount of drug to reverse her and wake her up quickly.
Kerry, the vet's assistant, has come down as Saba needs to be very carefully monitored. But a few minutes later, she's still hissing. To minimise Saba's stress, our crew have been asked to stay back as they head in to dart her once again. It looks good.
Just darted her, went in, stayed in, drug went off, so it's just a couple of minutes now and she'll be fast asleep and get on with the job.
But not knowing exactly how much drug she's had, they'll have to watch this old girl like a hawk to ensure that she does wake up again. Back on the cat section, Saba, the ageing serval, has finally fallen asleep. Jim and Jane the vet ran into problems giving her the dangerous drugs that knock her out. She had to be darted several times, so it's uncertain exactly how much of the potentially lethal drug she got. So they've got to work fast. Jane's got to work on the overgrown claws.
This is the problem one. I've left that.
Oh, this one.
So that is growing in.
Oh, yeah.
So
Must have been giving her some pain.
This is just like cutting fingernails. But if that razor-sharp claw had gone into her pad, she'd have been in big trouble. It was vital that they got this done.
So if you want to check them, if you want to take any more of them.
No, Jane, I think that's fine. I mean, won't give her any more discomfort, will it?
No, exactly. And she's had this problem a couple of years running, hasn't she? So at least they're cut as far back as we can.
Yeah. Yeah, like you say, it's made a little indent, but there's no
infection.
No, that's good. That's good.
Right.
Saba's sleeping well at the moment, but they need to watch her in case she stops breathing.
And so, as you can see, we're just taking some blood for analysis to make sure that her kidneys are still working or functioning properly for her age, and whatever else we need to check for.
At 19, Saba is one of the oldest servals in captivity, but in the wild wouldn't be expected to live beyond 10.
She's still got a fair set of teeth on her for her age, hasn't she?
Yeah. Saba's teeth in very good condition. There's a little tiny bit of plaque there.
Yeah.
But nothing too bad. For a cat her age, that's pretty fantastic.
Yeah, you wouldn't like to get bitten by them, would you?
Saba probably has most of the same problems as an older domestic cat at home. Because she eats bones and sort of whole prey items, she has pretty good teeth. But the diseases and things she can be affected by are exactly the same. So that's why we'll do some bloods. We've examined her, she seems to be in pretty good shape. And hopefully we'll wake her up in a few minutes.
Jane prepares to take her back to the shed, where they'll start attempting to bring her round. But with such an old cat, this is never straightforward.
Happy?
I'll let Kerry position her.
Yeah, no, certainly.
Kerry gives Saba a drug which should bring her round, but not knowing how much it took to knock her out, this is a delicate job. There are a number of signs that she must look for that means Saba is starting to wake up.
Obviously twitching, movement's the main one, but also reflexes. If I were able to touch her, which I'm not going to because if she is quite awake then she could bite me or something, but you know, you can touch the reflex in the corner of the eye to see if she's starting to wake up a bit. But yeah, obviously movement and things like that, looking for her respiration to increase and all those kind of things.
But with no signs, Kerry tries to get a reaction.
Yeah, just turn her over. Do you want to just come back?
Yeah, go on, yeah.
Turn her over, just stimulate her a bit.
Yeah.
We do a lot of sedation, especially with the cats and dogs in the park, so it can be a bit routine, but you're never completely satisfied until they're up and about walking around. So yeah. We just got to be patient now, and it's hard to be patient because you want them to be up, but actually you've just got to let nature take its course and let her body get rid of the drug itself.
Having looked after her for almost 20 years, Jim's not going anywhere.
Just going to test her reflexes with the straw.
She gets a reaction.
Yeah, it's all good signs.
After a tricky start, Jim's relieved the operation was a success.
When you've had a cat born here and you've seen her progress through the years, it's, you know, it's always a worry that when you knock something down that they come round and everything, especially when you've known them for this long. So I'm just happy that, you know, we've done the job. She's coming out of the anaesthetic, which is really good, and hopefully she'll be back out playing, you know, in the long grass very soon.
And a short time later, a much more comfortable Saba got back up on her feet once more.